name is Alexis Kohansky, and I am the Director of Member Engagement for Medical Alley Association. Thank you so much for joining. I would like to welcome you to the association's What Now, What Next webinar series. Today, our episode will focus on the challenges and opportunities of hiring and managing talent in the COVID-19 era. The pandemic has impacted the talent landscape and employee experience, challenging Medical Alley HR teams like never before. Shifting talent needs, hiring practices, resource reductions, and the sudden need for large-scale remote collaboration and communication have highlighted the need for flexible and resilient people, processes, and technologies. So how are we doing it? How is it going? And what have we learned? We are going to discuss all of this today. As we move through the discussion, I would like to remind all of you to please use the Q&A feature, and I will do my best to weave in those questions so our panelists have the opportunity to respond. Today, I am thrilled to be welcomed by a fantastic panel. And as we move to have them do introductions, after that, we'll dive right into the questions. So for introductions first, I would like to start with Sarah. Can you please introduce yourself and share a bit about your organization?
Hello, thanks Alexis and Medical Alley. Very happy to be here for today's discussion. I'm Sarah Fazio, the COO of Flywheel. And Flywheel is a cloud-based research data platform for life sciences, clinical and academic imaging research, and AI developers. The platform supports end-to-end research workflows at scale to streamline data capture from multiple sources, including imaging, EMR, digital path, among others. And the platform allows for annotation and curation of data for search, analytics, and reuse. And of course, all with secure collaboration, data privacy, and regulatory compliance. We are a growing team. We have 60 full-time US-based employees, 10 full-time global contractors, and a robust rotating internship program as well.
Thank you, Sarah. We're going to move next to Deb.
Great. Good morning. Thanks, Alex. I'm pleased to be here this morning as well. My name is Deb Gran, and I am the Corporate Vice President for Human Resources for North America, Diasorin. Lots of words there. It just means I'm part of HR. We are a global leader in the laboratory diagnostics market, specializing in immunodiagnostics and molecular diagnostics segments. Our global headquarters is based in Saluggia, Italy, and we have just over 2,100 employees across more than 20 countries at this point. Our North America locations are in Stillwater, Minnesota, Cypress, California, and Ontario, Canada. And I have the pleasure of being part of the team that supports the people side of our business for the 800 people that are within the North America footprint. My job and the job of HR is to ensure that the people side of the business is aligned with the business strategies and that we support those needs through various efforts in compensation, communication strategies, benefit programs, and organizational development. And I think it's going to be a great conversation today, and I look forward to it. Thank you.
Thank you, Deb. We're going to move next to Stacey.
Thank you, Alexis. I'm thrilled to be here as well with this panel. My name is Stacey Harney. I am the Senior Director of Global Talent Acquisition at Cantel Medical. Cantel Medical is roughly a $1 billion organization with 4,000 employees and a leader in the infection prevention space. So Cantel has 3 divisions. We've got a medical division, a life science division, and a dental division, again, operating globally all over the world. And a fun fact about Cantel Medical is that we make the masks. So the masks that you see everywhere, it's kind of a fun time to be in this space when you get to see what you do everywhere, every day.
Thank you, Stacey. Absolutely. I have so many masks. So last but not least, we're going to go on to Carissa. Carissa, can you please introduce yourself?
Hey, good morning. Thanks, Alexis. I'm Carissa Donnelly. I'm the HR director for our ENT business at Stryker. Stryker is a global med tech company that's headquartered in Kalamazoo, Michigan. And our revenue in 2020 was around $14.5 billion. We employ over 40,000 employees globally. ENT, formerly Intellis Medical, which many of you may remember, was purchased by Stryker in 2018, and of course was founded and based here in Plymouth, Minnesota. ENT focuses on a few main disease states right now: sinusitis, eustachian tube dysfunction, and nasal airway obstruction. So just a little bit about ENT and formerly Intellis Medical. Happy to be here. Thanks, Alexis.
Thank you. As you all can see, we have a wonderful panel, like I said. So we're going to jump right into the discussion. So I'm going to open this up with my first question. As we think about this topic, I would love to know more about hiring. So hiring talent in the era of COVID-19. Cantel Medical is, like you said, Stacey, a wonderful organization. Can you please shine a light on how this pandemic has impacted your hiring process?
Yes, thanks, Alexis. Great question. So this has definitely been a journey for Cantel Medical. And so a little bit of history on Cantel Medical. We are a number of acquisitions that make up this one big company. So we are in the process of really pulling together how we've done things all over the different divisions and all over the world. And so one of the things, I'll touch on a few of the things that we have done through the pandemic, really to change how we are approaching our hiring process, recruiting. One of those things is the shift in virtual interviewing and video interviewing, which I'm sure many of you have done this as well. And the good thing for our Cantel is that we've been a Zoom culture. So when I started, it was very different from where I came from. So I spent many days on Zoom calls already. So the shift for our business to switch to video interviewing wasn't necessarily a technology culture shift, but just more how we engage with our candidates. So it took a little bit of coursing and a little bit of coaching and just helping the business understand that you still can assess when you're looking at somebody via video and having conversation via video versus having them sitting in an office next to you. And so that it has gone well. I think the trickiest piece was getting to the end, and the final interview oftentimes is being conducted via video as well. And so it was a little bit challenging for some hiring managers to grasp that they're hiring somebody potentially sight unseen. So they're coming in and they're starting in the organization and they've never met them. But with all that being said, it has gone really well. The managers have adapted, the employees have appreciated the ability to have the flexibility, or the candidates, I should say, the ability to have that flexibility. In the long run as well, it has helped with the efficiency of our interview scheduling. We've removed a lot of the logistics pieces, right, of what buildings are we interviewing at? Are we in an office? Are we in a conference room? Where now it's been Zoom. And so that has become a little bit more efficient as well in how we approach some of that. So that also then leads me into the pre-boarding and onboarding. Once we've hired somebody, then what does that look like when we still have this remote setup? And so our buildings have remained open just in the event an employee wants to come in or an employee needs to come in, but essentially most non-essential workers have been at home. But we have done things such as ship equipment to them or ship supplies to them, so they are set up at home and they don't have to come into the office if they don't feel comfortable doing so. We do have protocols, again, if they do feel like that is a place they want to be, or they want to come in and spend time, they want to come in and get their computer, they can do that. But we have set up the protocols where we can ship out equipment. And then similarly, then moving into onboarding or day one, week one, some of our locations have a full day onboarding process or a full day new employee orientation. Some have smaller sessions. Those have all gone virtual or even been slimmed down a little bit. So it's a little bit more challenging to spend a day on Zoom versus a day in a room taking tours. And so that has been trimmed down quite a bit. Which, you lose a lot of that when you don't get to be on site and get to see the tours. But we've really tried to make those still as robust as possible by doing them remote. So shifting gears to a whole different piece on the sourcing side. So we've had a big challenge with our production and operators, so the recruiting and sourcing of production operator roles in our manufacturing environment. And there's, I think, a number of reasons that has come into play, but it's been hard to find that talent. So we were looking strategically at how we assess that employee population and how we're supporting that at our manufacturing sites, primarily around the US. And we've opted to shift that to attempt to hire models. So really coming into COVID has allowed us to really think more broadly around how we look at a whole population of employees. And so we're partnering with agencies that specialize in that space, since that's taking that off of my team's plate, moving that to a temp to perm environment, and really partnering closely with those agencies. We have a master service provider and a vendor management system on site that manages that for us. And we did have that at one location. We've now implemented that at another location, and we'll continue to expand that as well. So that's really a light that has come through this, because it's a program that we feel really strongly about, and it kind of pushed us to get it going at some of the other locations that we haven't had the opportunity to do that yet. So in wrapping up, I have just a couple other things. This has also allowed us to really focus on internal movement and opportunities. And as I mentioned earlier, we are a bunch of companies that have all kind of come together. So how do we work on talent development and movement, and allowing employees to see other opportunities within the organization where they may not know people at other locations? And we've had the opportunity to really focus on that, because at the beginning, we put a lot of our positions on hold. So we still had needs for work, but we weren't hiring a lot of people. So we had the opportunity to look at if we had people in different areas that could move over to other areas, or give them different opportunities that maybe before we hadn't thought about, because they were hired for this position and that's where they were right now. And so it really allowed us to open that up, and we're seeing a lot more movement now. And that's something that I think will continue to move beyond that. So all in all, that has been a great opportunity for us to be able to really focus on that.
Thank you, Stacey. So the concept of maximizing technology to create efficiencies in terms of how you hire, but then also looking internally at capabilities to develop your current talent, also for open roles. Sarah, I would love to hear kind of what you're seeing at Flywheel and what you all are experiencing.
Absolutely, yes. Much smaller scale than Cantel, but similarly focus on internal movement and promotions, looking to mine the talent we have and help with skill development and, job casting as well. And we've always had a remote employee contingent, but for some teams, we did have a slight preference for Minnesota-based hires. I think it was never about productivity concerns with remote work, but really our Minneapolis team has always had flex to work from home and work remotely. But the change was that as we were building teams, we really wanted to capitalize on the energy of small groups working together in person. And then COVID happened right about the same time that we had grown to the point of amping up our geographically agnostic searches. And we brought on some new recruiting partners, building those relationships as well. And it just really helped us to accelerate our total hiring process by squashing our local bias. It became clear very quickly that our teams were fully productive and engaged. And so we just didn't have any concerns at all. And that's just been a very positive thing for the teams and the org as a whole to bring in a really great group of talent. The main thing that COVID also changed was our onboarding process, as we became deeply focused on the remote experience. And one small piece of that is the kind of the Zoom fatigue that Stacey mentioned of, a full day of onboarding and sitting on screen. So we shifted our start dates to always start on a Wednesday and give people just a little bit of a shorter ramp up for that week. And also, as we found that candidates weren't taking the typical week or two in between roles that they used to, just in this heightened uncertainty. And so we could at least give them 2 days. And so, it's one thing when hiring a remote employee when travel is possible, maybe they come to headquarters in their first month, or there's the promise of an all hands gathering later in the quarter to meet everyone. But when those touchstones were no longer available, the total remote experience became so important, and especially that cultural quotient. So we did the remote onboarding did reveal some gaps in our documentation, specifically around cross-team education. So we've been working to correct that. But the culture piece required a little bit more attention in terms of amping up, not just, we had always done team lunches, remote and in person, and then one-on-one intros with department leads. And then we added a couple things, most successfully a buddy system for new employees to be paired with someone outside of their team, like a social shepherd, essentially. And the idea was really to make a connection with someone the way that you would in an office, and have a chance to build a relationship over non-work interests and conversations. So the buddies meet for virtual coffee or happy hour, or no beverages at all, sometimes just to chat. But we do check in and make sure that those connections are happening. And it's been we've had positive feedback from that too. But overall, onboarding is just always a place of continual improvement. There's always things you can do to get people ramped up faster or feel more included sooner. And so we do regular surveys and check-ins with our new hires. We like to grab that knowledge right away when it's fresh, and just solicit ideas for how can we continue to expand and refine our processes. And that's really been the focus.
Well, thank you. I think that, with Flywheel and the structure of your organization, I think there comes a lot of different innovation on how you handle some of these challenges. It's exciting to hear. Deb, I'm going to have you chime in next and to provide some perspective, but I'd love to kind of weave in some of the questions we're getting. And one is related to, utilizing video conferencing like a Zoom for interviewing, and how that may have impacted quality of candidates. Have you seen any differences in terms of who is interviewing on Zoom versus doing in-person interviews? And can you speak to that difference in your answer?
Yeah, absolutely. It has changed, I think, for multiple reasons, right? First of all, when we entered into this crazy year last year, none of us had a footprint or a blueprint of what it was going to look like. So, I can say that our team had really started looking at our processes and really refining our recruiting strategy the year before. And thank goodness we did, because we were already in that open-minded process of what do we need to do next, which really helped us as we started to look at how the candidate is going to be looking at us. And I think there's two areas that we really had to focus on outside of our own HR, lens of making sure that we have, touch points, that we're hand-holding, the candidate and the managers as much as possible. Because when it comes to the candidates, many of them were not interested in leaving their jobs. They're scared, at least through the first, 6 to 8 months, unless they were on a layoff situation. Then hiring them as a temp was a perfect, situation. And we did engage in more temporaries this past year than we had in the past to be able to accommodate that. But for some of our other roles that had already been open, we really had to do a different, what I call the dance, right? Of how do we make sure that communication goes to them in the proper way and allows them to feel like they can get a sense of who we are. So that really required us to work with our hiring managers and really focus on a different type of leadership or managerial competency for them, getting them comfortable. I remember the first person that we hired completely from beginning to end with no in-person. I think we all just kind of looked at each other and said, oh, we did it. It felt really weird, but we did it, right? That person has, worked out great, but we're also following those individuals a little bit differently as well. We have some internal tools that we use for onboarding and one-on-one processes and so forth. So we do have this sense that because they missed out on that socialization that you get on the onboarding piece, that we need to watch that, just a little bit more and help through that process to get people to a point where they're feeling like they're situated. So it's really been a kind of a hyper emphasis on, the conversation with the candidate, and then really helping the manager understand what they're actually looking for when they're doing the visual meeting with the candidate. It's very easy for the halo effect to jump in, or the opposite of the halo effect. So our TA team has done a tremendous job of really doing a lot of coaching before and after the interview with both the candidate and the hiring manager, so that we can put them on an equal playing field. And I'd also be remiss if I didn't mention our IT department, because IT was a critical component for our organization. We did have people who worked from home on a regular basis, but we had a large part of our population that didn't. And so we had to quickly get our managers up to speed on how do you use these tools when, you live in, boondocks, Wisconsin, and can't always get a good connection. How do we make sure, that you're going to have a good experience with that candidate? So they partnered with us throughout the entire process as well. I hope that answered your question.
Totally answered my question. I think we all love a good IT department, especially in this time.
Yep,
to make sure that
hard IT.
All right. So as we transition from talking about talent, I think the conversation around managing talent is also extremely critical in this area. And this is an area that I would like Carissa to start us off with her answer. But I would be curious to know, what has your organization done differently by way of how your employees work? Can you speak to the impact of employee culture? And have you all begun discussing return to office for your employees?
Yeah, thanks, Alexis. There's a lot in that question that we can unpack. So I think, like the other companies represented on this panel, Stryker's top priorities have been and continue to be just the safety and well-being of our employees and caring for our customers. With locations around the globe and a highly decentralized operating model, what may be unique for our company, if you compare us to some of our large company peers, I'm thinking specifically that might be headquartered here with a large centralized, headquarters. Think about our friends in Richfield, or maybe those downtown Minneapolis. Stryker has not projected an overarching return to campus or return to work date. Or like some of our friends, in California, we haven't, projected a universal permanent work from home perspective. And I think largely that goes back to just how decentralized we are and how big the organization is. And also the different, during the pandemic, different regulations and protocols that every country has implemented. Right. We know Ireland has navigated COVID dramatically different than the United States. But regardless of location within Stryker, we are encouraging our managers to engage with their teams by showing individualized support and discussing and meeting unique flexibility needs wherever possible, whether that's in the hiring process, as Stacey and Deb and Sarah touched on, or if it's just from how do we work in this environment going forward. From a culture standpoint, it goes without saying, right? This pandemic has increased stress and anxiety for everybody. Whether you're an essential worker that's going into the office, whether you're in the field hitting customer accounts, or whether you're teleworking like many of us. But I think what our organization has learned, like many others, is that we can be effective working in this virtual environment and embracing flexibility in a way that we never have. Our organization consistently pulses the workforce on employee experience, gathering their opinions, feelings, insights. And I think that approach, like others organizations on this panel, right, of listening, and then navigating this together almost in a co-creation environment has been really meaningful and productive for our culture. I think Stryker is really optimistic about the future of work, including this opportunity to increasingly tap into diverse talent pools, right? And we have not posted location agnostic roles like Sarah was mentioning with Flywheel. They have typically been tied to a location, a market, or territory. And as we are able to just rethink how we've done things, we can still continue to deliver results, but be more flexible, more inclusive, and engage in new ways of thinking. I think the third part of your question was on, have we begun discussing returning to the office? And currently in Plymouth and across many of our businesses, regardless of location, our sales, production, distribution teams, like many of yours, continue to work in our facilities. and in our customer accounts, since they're working directly with our products and interfacing directly with our customers. And of course, sales is following the local access and on-site rules of each customer account, which varies around the world and by account, it seems. So, I would say for the majority of our other functions right now, we are embracing this virtual environment specific to Plymouth. We continue to follow the governor's guidance and instruct our workers to continue to telework if they can. But as we look at discussing a return to office or return to work, I know that because of Stryker's largely decentralized model, our organization will take and has been taking a gradual, measured, site-based approach to returning to work in phases. We have specific guidance for each phase to maintain the safety of our employees, our customers, our patients, and we're continually trying to assess the state guidance that seems to evolve just when we think it's stabilizing, as well as assessing external and site-specific COVID cases and trends. And we've established criteria that will help guide each Stryker site on when it's safe to graduate to the next step of the phase.
Thank you, Carissa. I think you had a lot of there in that answer, and I really appreciate that. Deb, I would love to hear a bit more from you on how DiaSorin is approaching managing culture and also the discussion around return to office.
Yeah, absolutely. So I'll start by saying, I think we were one of the organizations that we were fortunate that our global headquarters was in Italy, which was in the heart of everything that was happening. So we as a leadership team, we ended up getting information, I think, more quickly of what this whole COVID thing was going to start to look like. And so we were able to very early in March, start to implement some plans and start to communicate some things to our employees of what was coming. Our CEO in Italy made it very clear on the phone with us, telling us what they were experiencing. So we were able to look to that even before some of the, executive guidelines and the CDC was, changing what they were saying every single day. So we put together a preparedness team in each of our locations just to make sure we had a core group of people who was monitoring that, met almost daily for the first several months to be able to pull that, together. What are we doing? And then also getting in front of the employees on a weekly basis to say, here's what we know, here's what's going to happen. And guess what? We don't know everything. Because whenever you pull a meeting, they think we're going to tell them everything. And we as leaders had to be pretty vulnerable and say, we don't know everything yet. Here's what it's telling us today. If you can all remember, initially they were telling us, you don't have to wear a mask. Well, guess what we're all doing today, right? So we had to really monitor and follow that along to get us to the point where, those things I think did and will continue to help impact our culture. I think that there will be a lengthy period of time before we know exactly what's going to happen with culture and employee engagement and so forth. I would hope that as I look at the efforts that our organization put forward, that there will be a recognition that the company stayed on top of things. They looked at, making sure that there was communication effort, but also really looked at the fact that we do feel that there's been a positive side of the COVID piece, which is really, I think many of us as leaders and managers do have a deeper understanding of what our employees' lives are like outside of work. So we've started to see some of that level of integration in those types of conversations and how to make that work going forward, especially because, as we talk about now, the whole return to work. Number one, we know in general that probably for each of us whose lives are very different and what we have at home base, there's just general fatigue everywhere, right? And so we've tried to put an emphasis on taking care of self and being mindful and being awareness. But, early on, if you asked our local president, we thought we'd be back to work by September. We put this nice plan in place and we were all ready to communicate it. And then all of a sudden it was like, oh, we better start slowing down a little bit and pulling back. So it's obviously lasted much longer, and that impact has made, working scenarios for our employees better or more difficult. And so when we talk about return to work, what we have done certainly is looking at our group in what I call a 3-level grouping, because we have 3 basic different levels of employees. We have our field employees who are servicing our clients in the laboratories with the assays that are necessary for these tests. We have our productions teams who are producing those. And then we have all of us, back office, admin support that probably had more likely to be able to work from home, but hadn't done that before. So we really focused on how do we meet the needs of all three of these groups? How do we protect our production group, from a building segregation to making sure that they've got the right work pieces. And then at the same time for our field employees as well. And then for the office group, it was more of do we have the right equipment? Can we get people home? Can we, work together on those things? As we noticed over the course of the couple of months, we were starting to get some challenges back from the employees because they wanted to start coming back sooner than what the government, or the governor has been saying from an executive order perspective. And we watch both Minnesota and Wisconsin because we're right on the border. So we have employees in both sides. And so what we've done to be able to accommodate that is, number one, we are an essential worker. And we want our employees to be able to maintain the best working possibility for them as well. So we redesigned some of our buildings so that for those that are in maybe a support position, but can be very effective coming into the office, more effective than working from home, they now have the ability to come into a workstation that, has the right depth, away from other workspaces, and they can get their work done. So we were able to accommodate people who were really saying, look, I need to get to the office. I need to, as part of my job and perhaps even as part of my mental well-being, which we thought was really important. I think the last part on that is, similar to what you've heard from others is, we don't have a finite date that says X date, everybody's going to be back to work. I think the thing that we've learned, and I'll smile here because my president and I have had continual conversations even before COVID about how do you manage work from home, right? In an office where people are used to being there every single day, we have a lot of hallway conversations that take place. And so although the electronic tools are very effective, we miss out on all those minor pieces because we're all block to block meetings. There's basically enough time to grab a soda and get back to your desk. So all of those little pieces we know make us who we are from a culture perspective. So I see the return to work continuing to be flexible as the cases continue to go down, vaccines start to happen. And I also see that in certain areas of the business, we will be able to be flexible in allowing continued flexibility for those positions and for those people that it makes sense. I hope that answered your question.
Of course it did. It was a fantastic answer. Thank you so much. Sarah, I think, like we always say, Flywheel has such a unique perspective in this conversation, and I'd love to hear from you on, how this pandemic has impacted the way you all manage talent and work internally. I'd love to hear your perspective.
Well, similarly to what Stacey mentioned earlier, we were already a pretty tech-heavy virtual meeting company. And so there wasn't, the shift was more to what Deb just talked about, the chock-a-block meetings for that reason. But we didn't really add any new tools, but we did start using them differently for the cultural connection piece. So we saw people organically started adding new non-work Slack channels, and there was a lot of chatter there. And employees came up with suggestions for virtual gaming events. We used to have a weekly board game night in the office and move that online. And then it became, more inclusive for the remote employees as well. And we were just really encouraging of those kind of creative ideas. They didn't all work perfectly, right? You had some fails with happy hours and breakout rooms and trying new games, but it was all in good spirit of cultural connection and really just making that effort and commitment. And we had a lot of buy-in from everyone. So I would also say that managers really took the lead on keeping teams connected and productive. Some teams on our engineering side, they do a half day or a full day a week where the whole team just works on an open Google Hangout. They're not talking the whole time. They're not meeting about anything. They're just doing their work, and you can, ask a question or share your screen quickly. So it's really like a simulacrum of sitting in a pod in an office and working together. And just earlier this week, I was on a Zoom that was a leadership team and infrastructure team coffee hangout. And one of our engineers who's based in Colombia mentioned that, we were always pretty good at the remote work thing, but now it's seamless. And been thinking about that a lot, because for employees who work remotely all the time, that sense of seamlessness is something we're going to need to be really vigilant about as we do return to the office. And how do we get better at manufacturing serendipity, kind of as Deb said, those hallway moments? What are ways that we can get better at that, so it's not just about overscheduling, and how do we let those things come up? Oh yes, when it comes to return to office, we are in what we're calling phase 0 of office work. And this means we have a roster of people who are scheduled to come in on any given day. We keep track of who's there for contact tracing, which fortunately has not been an issue up to this point, but it's very small scale, very low capacity, like 3 to 5 people a day. And we have lots of protocols and distancing. We rearrange the whole office and put up signs and rules, and everyone's following them beautifully. But we also do regular surveys and just also casual chats, kind of checking in. Where's the comfort? Where's the sentiment? How are things changing? And it's been working well. I think that, as Carissa mentioned, our buddies in California, there were some big, bold claims very early about what it meant for the long term. And we did that too as a tech company. I mean, we know we can work remotely, it works. And we said, no one has to come back to the office ever. So that was great. It's like, done, we'll just work it out as we go. And we got positive feedback, but we also had a big push from employees who wanted to come back. And we realized that it was a mental health issue more than anything. Everybody wants a break. Everybody needs a break. And we saw this as an opportunity where we could help. We could provide a space for employees to go that wasn't their house or their car. So we wanted to give that a little bit of relief, before the full burnout hits. And the phase 0 it's working for us. We have some early ideas about what phase 1 will look like, but no timeline, no commitment. And we're pretty happy with where we are now.
Fantastic. Well, thank you for sharing that. I think that at the end of the day, employees, it's not a one size fits all, right? So it's just continuing to be sensitive and understanding of different lived experiences. So as we transition into kind of the final area, where we're going to have all of you provide your perspective on, I would like to talk about best practices, takeaways, or lessons learned. And I'd love for all of you to share your perspective. And also, this webinar is about the impact of COVID, but I think we'd be remiss to not acknowledge that this year has been more than just COVID. There's been a lot of unrest in a lot of different ways. So if you all could speak to the impact of COVID, but also some of these other dynamics that have been happening just in the world and what they experience, and how you can kind of loop that into how you've been working with talent, how you approach recruiting, but mostly, like I said, missteps, challenges, areas of opportunities. And I'd love to hear your perspective. So we're going to start with Deb on this first question, or as the first panelist to answer.
Okay, great. Thank you. I'll start with just a couple of things. I was writing some notes as you were talking. So, if I think in terms of, missteps, challenges, opportunities, missteps, to me are, a little bit of the lessons learned. I feel like we always have lessons learned, and no matter what we do, we were, as I said earlier, fortunate to kind of jump in and understand what might or might not be happening. But we could have used maybe some of our internal tools to help with that. So eventually we developed a one-on-one tool template for our managers to use, so that it was easier for them to have the conversations, because many times they were waiting to hear from us. What should they be saying, and we were saying it in a meeting, and they just wanted more detail on that. So we started to really enforce some of the tools that we have in a manner that the manager or employee could or could not use. It wasn't a forced opportunity. It was just to kind of be out there. So I would say the only misstep in that is maybe we could have recognized that sooner and built that in. And then certainly the communications with the employees, being comfortable and learning to be comfortable to say, I don't know. this is how it is today. I think over the course of 12 to 20 weeks, our executive leaders got very comfortable in being that vulnerable, which I think was I don't see that as a misstep. I think it was a great learning piece. If I think in terms of challenges or concerns, I think that anytime a change happens in an organization, there's a pocket of people who just want to go back to norm. And that norm is not here anymore. Regardless of what happens with COVID, we need to hang on to the things that have helped us move forward throughout the process, whether it was the technology and the support from our IT and understanding how to utilize our tools better, or have them integrate, being able to use Zoom meetings and how do you engage in those areas, and still figure out, how much can and should we be in the office so that we don't lose out on that, that mid-company size feel where we have those hallway discussions. So I think that's still going to be a work in progress for us. And it requires, from my perspective, it requires a lot of honest discussion with, HR and with leaders, because at the end of the day, some positions, it just doesn't make sense. Others, it might make sense, but the person in the role might not be the right person to be able to do that full time. So it's really building that flexibility so that we can continue to create what that new normal is. Because the examples I'm giving are very small. I'm sure throughout the entire, last 12 months, each of the divisions have shifted, done different things in a business to be able to accommodate the fact that half their staff is out right now because somebody got exposed. So not losing out on those things, I think will help us define what that new normal is. And then I think the last piece that I look at from an opportunity perspective is something I mentioned a little bit earlier, which is, I think, myself, other leaders, other people in the HR department, we have definitely seen examples of how our company has had a little bit more of an inclusive hat on. And I referenced that a little bit earlier about the fact that, we have employees who never expected to work from home, don't have a home office, are now teaching 3 children. Grandma might be there, but she's got COVID, so she's in the back, office, and they're not a teacher themselves, right? And I think there's been this shift of managers kind of seeing that, and number one, hopefully embracing it and letting our employees know, look, I know you're going to have your daughter sitting on your lap during the meeting. That's okay. I got a dog barking in the background, So, I mean, it's that type of thing that I think we have an opportunity to build upon. And I see it as a really nice and open example of how people need to look at, their workmates differently. I've said to my team, I won't say my age, but I'm old, compared to my team, right? My kids are all grown, my husband's, semi-retired. My worst day is when my dog's barking, right? But she barks and she's annoying. And I don't have that same challenge of, oh my gosh, I'm on the phone with the first time with the corporate VP and, my daughter is banging on the door because she's, got to use the restroom, right? So it's as a leader being able to give that semblance of, what, we are fine. Don't worry about this interview. We're fine. This is life. This is life. And how can we expand that now into building further, into our culture, that flexibility, that caringness that we used to show in different ways, I think can now be built into a much bigger part of the heart of our organization.
Thank you, Deb. So definitely the people behind the roles, the people of this, that's being more and more exposed to this experience. And there's a lot of good that comes from that, especially in how we work together as teams. Stacey, please share your perspective.
I will start on the misstep piece of your multi-pronged question. It's so with Cantel, as I mentioned earlier, we are really in infancy stages in some of the building programs and building our approaches and how we want to do things because of the way that we are made up. And so one of the things I think we could have done differently or a lesson learned for us is the reaction time on how quickly we jumped on the company needs things, and the company, this is different. And I don't think anticipated that we would still be having these conversations in February of 2021. And so thought it would be short-lived, thought we would get through it. And, here we are almost a year later, and I'm still struggling with some of the challenges that COVID has presented. And so one of the things in hindsight now, I would anticipate we would do differently is be more prepared to react quicker and have plans in place and just be ready. I think the way we got through it so well, or that we are getting through it so well, is that the company has shown compassion and flexibility as a whole. And so while we don't have the programs and the processes in place or the policies in place around work from home, we've really put out, or the leadership team has really put out there, that this is a difficult time. You need to do what you need to do. We understand, like Deb, as you mentioned, there may be a baby on the lap, you may be teaching school, like this is okay, and we're going to all get through this. And so it's been very supportive, and the leadership team has been very supportive and just compassionate around what the teams have been going through. The other thing, when we get into opportunities and challenges, which was your second and third part, for me, that really is almost hand in hand. The opportunity is also the challenge, and vice versa. The new normal, again, as Deb mentioned, we can't ask 11 months in, we can't ask employees to go back and do what they were doing a year ago. That's just, everyone has evolved. There's new ways of living now. So to go back, it's just not feasible. But that brings then a lot of education to our leaders and to some of our teams, that work that we didn't think could be done remote really can be done remote, and it can be done successfully. And so at the beginning, I think there was some hesitation around it. We had to rip the Band-Aid off and allow employees to do it, and then all of a sudden it's successful. It's like, oh, we can do this. And so that does open up, from a recruitment standpoint, our ability to look broader than just the location where the position may have been based before. So that brings us a lot of opportunity from talent pool standpoint, and just allowing our employees additional flexibility that are in functions that maybe that wasn't the case before. But then on the flip side of that, when we talk about the challenging piece of that is, and this has been mentioned earlier as well, we lose those organic conversations. We lose the ideation sessions that are happening on the fly and that are happening as you're walking down the hallway. You're losing the interaction, engagement of the team that sits next to you that might not be part of your team, that you don't really interact with too often, but because they're close proximity, you talk to them, or and you find things out. And also from there's the ideation piece, but then there's also that employee development and talking to people that you might not talk to on a day-to-day basis, that are getting to understand your backgrounds, that you're not going to get that over Zoom because it has to be a scheduled call. And so you lose all that organic relationship piece, again, whether it is in the product development space, whether it is just in relationship building. So my final thought on that is really, how will we combine that balance of allowing employees to still remain in this flexible work environment, remaining working from home if they so choose, and then the balance of those organic relationship building. How do we balance that? It's kind of my final thought, and I think where Cantel sits in terms of how do we look at that going forward.
Thank you, Stacey. Carissa.
Yeah, thanks. I'll build on what Stacey and others have said, just from, one of the lessons learned or missteps from early on. I think, unlike Cantel and Flywheel, that were probably much more savvy from a technology perspective, maybe I should just speak for myself. But, Stryker's now largely virtual environment for many functions has leveled the playing field, right? And minimizing what Sarah talked about earlier, right? The distance bias, the local bias, where everyone's just forced to engage through technology. And looking back, I would say there was an opportunity for the organization to be more intentional in supporting hybrid interactions specifically, right? So we talk about, if you've got 2 essential workers in a conference room on site and everyone else on a team is remote, how could we have helped leaders and managers more quickly adapt to this hybrid environment and be more intentional about inclusivity specifically? I think each one of us on this webinar has probably had that experience of being remote in a hybrid environment. But I think the difference is the frequency of these hybrid interactions pales in comparison to what we can expect to see going forward. So we need to get better there as we return more people to the office in some capacity, as well as continue to embrace the future of work, whatever that might look like for your organization. And so an area that brings me concern, but is also something that I look forward to, and this builds upon what all the other panelists have said, is just how Stryker will continue to differentiate its culture through its people. Stryker has been historically a highly relational, in-person culture based on these, I love what Sarah, you said earlier, these serendipitous moments. Those hallway interactions, those great ideas that you have right after the meeting or before the meeting. And it's just something that we're going to need to be more conscientious about, right? How we recruit, how we develop and engage, how we work will, as others have said, will not go back to what it was pre-COVID. And whatever our work location, style, environment, this intentionality around culture and what we want it to be needs to drive inclusivity and belonging for our people and our customers. And so there won't be a universal playbook for every organization. There's so many different kinds of organizations represented on this webinar, but it is going to be a really exciting journey to navigate, but something that does keep me up at night. Alexis, you also brought up, some of the challenges over the last year and a half with regard to civil unrest, and gosh, you could just keep going down the list, right? The election in the United States, but I'll stay away from that. I think specific to DE&I, one of the great opportunities that we've had in the aftermath of some of these tragedies is to reaffirm and communicate just the commitments that we have to diversity, equity, and inclusion, not only for our workforce, but for our partners, our customers, right? Commitments specifically to strengthen the diversity of our workforce, advancing a culture of inclusion and belonging, which I talked about a little bit, and really maximizing then this power of inclusion to drive innovation and growth. Specifically, we've done unconscious bias training for all of our managers within the division that I work in. It's rolling out worldwide, and this wasn't new or specific to George Floyd's murder last summer. This was something and a journey that Stryker had been on for a couple of years, but the momentum and the demand for us to address some of these inequity issues just really became important over the last couple of years specifically, right? Talking about what diversity, equity, and inclusion each mean, because they're not synonymous. It's not a catchphrase. And even thinking about ERGs, I think I saw in the chat, there were a couple of questions around ERGs, and I'm sure my peers on this panel can also speak to their efforts. Stryker right now has 9 ERGs. We just launched a new one, our Asian Community Empowerment Network, at the end of 2020. Our ERGs are very bottoms up, employee-led, given our decentralized structure. The specific to our Minnesota team, our ENT business unit launched 2 ERGs last year alone, led by some phenomenal employees in the organization that tackled really difficult topics like raising your voice as a woman and what that means, having a seat at the table and inviting women in our leadership ranks to actually sit down virtually with our ERGs and have conversations. We talked about what Black History Month, we're now on the second annual year for our chapter talking about Black History Month, having difficult conversations, diversity recruiting, obviously multiple times, media bias. I think what is so incredible about these ERGs is these chapters are so incredibly authentic, and they can have a significant role in the employee experience, from attraction and hiring to engagement and development, and ultimately hopefully that helps create these communities and sense of belonging that our employees need and crave, especially in this time when we still feel so disconnected from each other.
Thank you, Carissa. Thank you
Yeah.
for that thoughtful response. Sarah, please round us out.
Sure. Well, I'll pick up what Carissa was saying, that's just a beautiful sentiment that, of course, DEI is not one word, right? They're three very important and distinctive concepts and promises that have really come out from this moment of cultural reckoning, or hundreds of years that have culminated now. And the thing that we've seen is similar, that it's really a combination of a commitment from the top. And then that means a commitment to hold space, have the tough conversations, give the time, but really address it head on. I think that we're just so past the point where it would be considered unprofessional to go there in the workplace. And that's been something that I think is that breaking open of vulnerability of leadership, and also giving employees some real muscle behind ERGs, and also new creative ideas. We had three groups that formed around this one, around recruiting and hiring, that's really about pipeline and also the consistency in the interview process and hiring process, as well as a group on cultural connection and education. We call it a journal club, because book club it seemed too hard to get people to read a whole book. But then now sometimes we just all get on and watch TED Talks, and then have a facilitated discussion, which that's been really wonderful and rich. And then lastly, around community engagement, and this idea of really working in the neighborhoods where we live, and where our office is, and working remotely as well with that. So our focus so far has really been on donation and matching donations of employees, but also moving to volunteer opportunities as well. I did want to say one thing about the misstep that we made, which was, as Deb said, a great learning opportunity. It was really around this idea of duty of care for employees. Like, what is our role beyond keeping people physically safe? And as a startup, we talk a lot about the idea of just enough process, right? Let's not over-engineer and not overcomplicate. We don't want to add a bunch of bureaucracy. We're comfortable just taking a bold initiative and figuring it out and getting on with it. And that mindset really is what we took into the early days of the pandemic. We wanted to just project a message of flexibility. Do what you need to do for you and your family. Everything's fine, in this breezy way that would really instill a sense of individual freedom and openness. But after a few weeks, it became clear that message of flexibility was too vague, and it didn't provide real clarity and stability that people need in totally unsettling uncertainty. So we addressed that in a few ways, from as small as like acknowledging children and pets on Zoom, bringing them into the conversation in the middle of a meeting, to also really doing meeting-free days and weeks, wellness challenges with COVID activities like go outside or clean a surface. The list goes on. And I think that in the no going back way, that evolution is, how do we carry all of these things forward and continue the commitment that we've made, and to this agile approach to adapting. And to that end, the last thing I'll say is there was a question about what type of games can you do virtually with teams, and we really like Jackbox. It's a combination of online and your phone, and it's free and easy, and you can do breakout rooms so people can pick their own games. So I'll leave it there, but thank you.
Thank you, Sarah. Okay, so I know we're about to be at the top of the hour, so I just want to take a couple seconds to just thank our wonderful panelists for this very thought-provoking conversation, and all of you for sharing so much insight. This is an extremely important and timely topic that is impacting all of us. So I just want to thank you all again. And I want to remind all of our viewers to please join us again in this What Now, What Next series that Medical Alley does. We are dedicated to delivering tools, resources, and guidance for your organization to navigate this new and always changing environment. So I do feel like today we had some discussion. I wish I could talk even longer about this. There's so many more areas we could go into about this such an important topic. But please continue to engage with our association through medicalalley.org. And I am so thankful for all of you joining us today. And I hope to see you all at another webinar. So thank you.